Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. And guess what? It's not just me today, but I guess I don't really have a guest. I have a co-host. Caliyah from my office is here today. We've been talking about a lot of things with health insurance, and we run into sometimes some unusual situations, and she's got a little bit of experience in them. Some of them she's dealt with personally, so it kind of helps. And it's been crazy. As we're recording this, this week hasn't been real busy, but last week it felt almost like we were in open enrollment. It was but everybody wrote something. Yeah. Everybody on our staff wrote somebody in health insurance last week. So it's been busy, and it's crazy because, we're in the middle of the year, but people have special enrollments all year long. They leave a job, they age off their parents' insurance, change jobs, all kinds of different things like that happen. So. And we've got one in the works that somebody's leaving the school system, and they've got insurance through June, but July they're no longer employed with the school system, so they're going to need insurance. So keep that in mind. A lot of people think they have to wait to open enrollment. The other one is sometimes their income. If they're a lower income, they may qualify to get a special enrollment in the middle of the year also. So don't just think you can't get insurance. Call and ask us. Going to add anything to that?
No. Another thing, custody. That definitely changes things. So if you get a court order in the middle of the year that you are, required to hold insurance, that gives you a special enrollment period as well. We would just have to submit that to the marketplace or wherever. Yeah,
I was talking to somebody yesterday that has a adopted child, and they're thinking they may adopt another. And a lot of times when you're adopting, especially like if you're adopting out of the foster care, a lot of times they're on TENNCare.
Right.
And so even though you're adopting, they may keep their TNCare. You want to address that a little bit? You're kind of my TNCare expert.
So most of the time, even if you are provided with TNCare for the situations, adoption, in my case, pregnancy or special needs, things like that, TNCare also requires you to have another insurance that you primarily bill on, before you bill TENNCare. So a lot of times, even if you have TENNCare, that's not sufficient enough for them. TENNCare really doesn't like to pay for anything.
Right.
They're going to pay for the bare minimum that they have to. So in my case, we have to fight them to pay just co-pays to go to the doctor that you have on your regular plan.
Right.
So a lot of people don't realize that just because you may get TENNCare for that special period of time or for life, for adoption and things like that, they're not going to pay for, they don't want to be your primary insurance. They're not going to pay for everything.
Right. Now, you mentioned that, are there times that TENNCare is approved just for, because you have a special situation, but it only covers that situation?
Yes. So pregnancy is a big one, and postpartum. My TENNCare currently doesn't really pay for anything diabetes related because, I was diabetic before pregnancy. So They will cover my maintenance drugs as far as things that I need every day to live. But they're not covering your endocrinologist and things like that.
That's what I was going to say. If you have to go see the endocrinologist, that's not covered by TENNCare.
Right.
They're just covering the pregnancy.
They are covering pregnancy-related issues.
Okay.
I had to go to the hospital for my blood pressure a couple months ago. Once they deemed that was not blood pressure or pregnancy-related, TENNCare left me with a hefty bill to pay because it wasn't pregnancy-related. So a lot of times, yeah.
How's that not pregnancy-related?
Right. But they said where I had an infection, it wasn't pregnancy-related. So a lot of times... So
they're saying the infection was causing your elevated blood pressure.
Right.
I didn't know that.
So a lot of times they don't, a lot of people just think, I have TENNCare, so TENNCare will cover it. That's not always the case.
This is great. I'm learning. I didn't know this.
Yeah.
That's what I said. That's why, and that's one of the reasons I brought Caliyah on, because like I said, she's dealt with some of these things personally. I've been doing health insurance for 10 years now. But generally, it was kind of like, you got TNCare, I can't get you a subsidy, go away. But there are situations, like we said, we talked about the custody, the adoption. The other thing that comes up a lot with custody is you have split custody or part of the child care arrangement between that every other year a different parent claims them on taxes, which the subsidy with health insurance is a tax subsidy. So that really throws a wrench in that we have to worry about that. Have you dealt with anybody like that yet?
I haven't. The multiple people that I've put on have been able to claim them every year. Mm-hmm. In our case, our child's mother claims her every year, so we couldn't hold her on any kind of tax subsidy if we wanted to.
Right.
She would have to write that.
Mm-hmm.
Now, in that case, we would, make the arrangement that, the other parent can always hold it and you just pay the premium or, however, but definitely can get into a sticky situation if you're alternating years or anything like that, because obviously that kid is going back and forth.
Yeah.
And another thing to keep in mind, too, is they don't count towards your tax household in the marketplace if you don't claim them on taxes.
Right.
So, if you even have split 50-50 custody and they claim them every single year, you still can't put them in your tax household. So that lowers the person in your household.
And you're talking about the tax household. Another thing comes into play in these custody situations or divorce situations, I guess I should say. Child support and alimony. Alimony is income.
Yep.
And it affects your tax credit because it is taxable income. Child support is not. And it's not tax deductible either. So if you're paying child support, if you're not claiming if you're not claiming the child that you're paying child support for on your taxes, you're not able to deduct that income from your income when you're doing tax credit. So those are the things that we work with, kind of trying to figure out to help people. And then even though a lot of this stuff is tax related, we will also say we are not tax preparers. We're not professionals. This is what I think will happen, but contact your tax preparer to be sure. And there's been times that I've actually had to tell people, go and tell your tax preparer this, because they were giving them bad information too. So they're not always perfect. We're not licensed to give that advice. But what had happened was, the case that I'm thinking of was the person didn't make the estimated tax or estimated income to where they qualify for the tax credit. A lot of people think, I don't get any money, I should get the tax credit. Sorry, not in Tennessee. Some of the states did what they call the expanded Medicaid, which Kentucky has done that. So especially somebody moves down here, maybe they had state subsidized, or they don't realize it's state subsidized health care, but they're not qualifying for TENNCare, but they don't have enough income. So it just gets me sometimes. Some people think, I'm just going to move to this state. If you're on Medicaid, really rethink that.
Right.
If you're not moving in with a relative that's going to help take care of you, and again, if you're listening to me, that's probably not going to happen. But if you've got, a relative that, or somebody that's maybe going to move and they just want to move across the state board, they get a new significant other and they want to move in with them, but they live in a different state, but they're in the same situation. They don't have any money either. They could be in a bind.
Right.
Those are some things you got to kind of look out for. Don't just move because you think it's going to work out. I actually had a situation like that. Somebody moved from California to Kentucky, and they were referred to me by somebody else that I helped out. Well, they had what they call Medi-Cal. I think it's so funny because if you look at the word, if you don't have the dash in it, it's the word medical. But Medi-Cal is Medicaid. In Tennessee, that's TENNCare. Those are Medicaid programs. They're managed by the state. But this person, they moved to Kentucky because they were told it costs less to live here. Well, in a way. But when your state subsidized for everything, it's not necessarily going to save you any money to move to a state that has a lower cost of living. If your health care and your housing's already covered and you have food stamps, you're not gaining by moving to a state with,
Right.
So that was one of those situations. Court-ordered coverage. That becomes fun.
Touchy subject, right?
Yeah.
One of the most ridiculous things that I think that I have ever seen is the court ordering coverage in a situation where maybe it is 50-50. They do split equal parenting time. But, when you look into going on, employer coverage and things like that, those plans can be outrageous.
Right.
And another thing that a lot of people don't realize if you don't deal with that situation is you're not getting credit for all that you pay to your employer coverage in child support and things like that. Likely you're getting a set percentage by the judge or a set percentage by the state. So when those things start adding up and racking up, you may only get a percentage, 10% of that, coverage that you pay out of pocket every month, maybe only 10%, 15% goes into your child support obligations, and you're credited for that. So a lot of the times, the court orders coverage. The judge says dad must hold coverage if it doesn't exceed X amount of their income, or mom must hold coverage if it doesn't exceed X amount of her income. Their choices for that most of the time are the marketplace and things like that. But then again, if you don't get to claim taxes, which in the state of Tennessee, a lot of times, unless the parents mutually agree, whoever is receiving the child support is who is ordered to get every year on the taxes, and then also the other parent would be responsible for holding the coverage.
Mm-hmm.
In this case, most of the time too, that's even if the kids are on TNCare. So, it's a touchy subject when you can't afford or you're not provided employer coverage. And then they're like, okay, well, you can go to the marketplace.
Yeah.
Okay, great. Well, you go to the marketplace and then you can't do anything because you don't claim them on taxes. So then you're forced to pay
the full price of that,
and then you're not receiving credit for all of that.
Right. And a lot of times, like you said, because they're in that kind of lower income, I want to say, and not to say low income, it's just a lower income. It's kind of a middle-of-the-road income. We have the Children's Health Insurance Program, which is CHIP, which is administered by TENNCare, but people can qualify it with a higher income than they would for TENNCare. And a lot of times, their child could be on CHIP or TENNCare, but because it's court-ordered, they have to buy insurance.
Right.
And you said, the employer plan, it can be anywhere from $300 to $600 just to add your child to your employer plan, depending on how much, whether most employers today do not subsidize family members.
Right.
A lot of them used to pay 100% of the employee and 50% of the family, and everybody thought, oh, that was very affordable if they had a group plan, which is partly why the ACA kind of came about, because people who were getting insurance through their employer were paying very little for their health insurance, and they had, $1,000 deductible,
right.
$10 copays, and all their generic prescriptions covered, or for $5 or zero. And so they thought, well, everybody thought, oh, that's what we need. Everybody should have that. Well, the problem was, once the ACA came about, premiums skyrocketed.
Right.
And it also affected the employers, because the employers had to offer. So a lot of them, and just generally, health insurance costs, we have inflation every year. Those costs go up every year. And so the employer decides, I'm going to save some money. We're going to quit. We were paying 50% for the family members. We're not going to pay them. They could still add them onto the plan if they want to, but they're going to have to pay for it. And that's where we run into a lot of people. And a lot of times they'll come to us and they think they have to have a family plan, and they say, I can't afford my employer insurance. So how about educating us a little bit on that? And, if we miss something, I'll pick it up.
So with your employer plans, what we deem affordable and what the marketplace deems affordable are two way different things.
Right.
So our kind of rule of thumb is about 9% of your income is where the marketplace deems that's not affordable.
Hold that thought. I just realized we were on a break.
Oh.
This is James Green, your local Twin Lakes security sales consultant. This summer, whether you're off on a grand vacation or enjoying a staycation in your own backyard, our smart home solutions make it a breeze to keep tabs on everything. With our remote video monitoring, alarm notification, and power outage alerts, you can enjoy your summer worry-free. Already have a security system? No problem. Switch to Twin Lakes today and score 3 months free monitoring on us. To learn more, call 931-528-2005 or visit us online at twinlakes.net.
Twin Lakes Security, TNCert C-0026.
Looking to spruce up your home without breaking the bank? Visit Habitat Restore for incredible deals on furniture, appliances, home decor, and more. Plus, when you shop at Habitat Restore, you're not just getting great deals, you're also supporting your local community. Are you looking to make a meaningful impact? Consider donating to Habitat Restore. Your generosity can make a world of difference. Habitat Restore, open Tuesday through Saturday, 10 a.m. to 6 p.m., and located at 560 South Jefferson Avenue in Cookeville.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, well, we're back, and I had to cut Caliyah off on her answer because I wasn't watching the clock real good, real well. She was talking about the affordability, the employer plan versus the marketplace, and you left off with about the around 9%.
Right, and we can There's like a very specific percentage that, if you're right on that line, that we don't care to, get down to the nitty gritty and,
Right.
Work for you. But typically about 9% is where we say that that's not affordable.
Right.
So a lot of times, if it exceeds that 9% of your income, then you do qualify for subsidy and the marketplace in general. So a lot of times what we'll see is employees, they fall within that 9%.
Right.
Most of the time.
Mm-hmm.
If they don't, or if it's so close that, you just need to basically take it
Right.
most of the time. But a lot of times spouses and families, they don't fall into that 9%.
Right.
And that kind of goes in with the, now that they're not paying for anything. So they may still get a little bit of a discount or whatever from their employee, like their employer, but they're not going to do that for your family and your spouses and children.
And a lot of times that the employer plan, one of the things they've done to save also is raise the deductibles.
Yes,
So they're paying that out of pocket. They've raised the deductible, and I've done quite a few where people come. The employer was like, "Okay, you as the employee are going to need to stay on the group plan because you won't get a tax subsidy, and it will cost more to do your family with the rest of your family on a family plan." But a lot of times, we can move that spouse and one or two children to a plan through the marketplace and get a really good subsidy. They're paying less, and depending on their income, what do they get with a silver plan?
And cost sharing reduction. That definitely plays a factor into people seeing the benefit of that too, is because those deductibles are going to be way more affordable and way more appealing to the eye. You're not seeing these crazy $8,000-$9,000 deductibles.
Right.
You're probably seeing $2,000 to $3,000.
Yeah. Now, I have found a lot of times that even if the family decides to go somewhere else for their health insurance, they can still get the group dental and vision and those kind of plans. And I usually encourage the people, go ahead and do that. I can't, we can't compete with those prices for a dental or vision plan through an employer. They're much lower premium and cover as much or more than the standalone dental plans. But if you don't get one through work, they're affordable, but they're not competitive with employer plans.
Right. And another thing, too, is a lot of people think that if they deny one thing through their job, they can't get the other.
Right.
And most of the time, that's not the case.
Right.
Most of the time, I had a guy that I wrote a couple weeks ago. He was like, the thought of just having it all in one place is appealing to me.
Mm-hmm.
And then he starts looking at, what they paid for versus what we pay for, or, what some of our plans pay for.
Right.
And he was like, okay, never mind.
Yeah.
But because a lot of people do think, yes, it's so much easier just to have everything in one spot, and I know who I can call to help, and I don't have to go through work and things like that. But in the long run, a lot of times, if your employee is covering dental and vision, that's where to go.
Well, I've ran into people, especially, I haven't seen it as much lately. I did when I first started, but I haven't seen it that often. But I've ran into a couple times that, like, somebody got a cancer plan through Aflac when they were through a job, but they're not at that job anymore. But those kind of plans like that generally will let you keep the plan because they're normally paid by payroll deduction. But if you make the arrangements before you leave the employer, or before your policy cancels, and pay the premium, they'll let you keep the plan, and you keep it at the same premium.
Right.
So it was like, I was like, yeah, don't let that one,
don't
let
that
one
one
lapse,
lapse.
because to replace it would be 2 or 3 times as much.
Yeah.
Plus they're older now than when they got it.
Right.
So
maybe worse health. Maybe they wouldn't qualify for it now. A lot of different things.
Yeah. Well, actually, I think the case that I'm thinking of, he was also a smoker, and so some of those plans, they'll charge higher for someone that's a smoker. I mean, life insurance, obviously, but like a cancer plan, some of them do, some don't. But like you said, he was older. He'd had that plan for several years. So if I was going to write him a new plan, he's maybe 5 years older than he was when he got the plan. And a lot of times those are based on your age. So it's kind of funny with things like cancer plans that the younger you are, the less it'll cost, because the stats for cancer is 1 in 2 men and 1 in 3 women will encounter cancer in their lifetime. So you'd think someone who's older, I guess they look at it, well, if they're older, they're getting closer to actually having it happen versus,
Right.
hey, it hasn't happened yet, so to me the odds are more that they're going to claim it.
Well, and I think, too, as bad as it sounds, I think a lot of insurance companies, when they're doing that, they think of like 5 to 10 years is probably how long you're going to hold that policy.
Right.
You know, if something doesn't happen in those 5 to 10 years, you're going to let it lapse, you're going to cancel it, you're not going to, maybe you don't see the benefit anymore, you know, however. And so they're like, okay, well, you know, if you're 25 and getting a cancer plan, the likelihood of you having cancer before you cancel this policy or
Right.
stop paying for it are going to be less than a 65-year-old.
And if you make the premium too high, the person won't buy it,
Right.
especially a young person.
Oh, yeah, for
Because
sure.
they're 10 foot tall and bulletproof, as I like to say.
Yeah, we see that often. But, you know, back to the dental and vision, too, another thing that a lot of people don't realize is that when you go through the marketplace, the children are getting that dental and vision,
Right.
the pediatric dental and vision. So the clients I met with last week, she was like, we're going to need it. You know, they get 6-month cleanings and they do all the things. And I was like, you don't need that for them. You know, if you
That's
guys,
the one thing that's covered.
right. That's one thing that they take care of on the marketplace is if you have a pediatric, it's under the age of 18, they're going to receive dental
Now, I think
and
there are
vision.
limits to that, though, on those plans. I mean, like you said, they're going to cover the cleanings. They're going to cover a couple routine fillings, but I think there's a limit on it. You know, like if child does have really bad teeth, they're not going to cover.
Right.
If they need several fillings, I think there is a limit on how many fillings a year or something like that. But it's not perfect.
No,
but don't
nothing
pay extra.
is. Nothing is.
In my experience, what I've run into is I've sold somebody a dental plan with their health plan for their ACA plan. And, of course, they're calling me from the dentist's office, and they say, my insurance is no good. My dental doesn't cover. And I'm like, did you give them your such and such card? Yeah. I was like, you notice where it says dental, there's a little word in front of it that says pediatric? That's not your dental insurance.
Yeah.
And then I usually have to go and get online and find their ID card. And actually, the one plan I had, I don't know if I even get the ID cards anymore, but I would print it and then text it to them, or download it and text it or email it to them, because they were trying to use their health insurance at the dentist, and their health insurance wasn't their dental insurance; it was a separate plan. So that's what I've run into more than people telling me, no, you don't need to put your child on the dental plan. They're going to get it. So.
Yeah, especially if they've got kids and they get all the same cards. You know, you get one set of cards.
Yeah.
And then it says pediatric dental, and you're like, well, okay.
Yeah, and I think the vision covers an eye exam, but I don't think it covers anything for eyewear.
I've noticed that seems to be very company dependent. So it seems like Blue Cross typically covers a little bit, especially if the kids are needing something like that. Definitely not going to cover anything extravagant.
Right.
But, your basic set of lenses or something like that,
Sure.
They may. And a lot of times another thing that people don't realize is you can go to like like a specialty eye doctor that classifies as their medical.
The ophthalmologist.
Yeah.
Yeah.
And see that under your health insurance.
Right.
You're just going to be responsible for paying for your glasses.
Well, that's like, again, you mentioned earlier diabetic. Are you probably are supposed to get an eye exam every year with the ophthalmologist, and again, that's medical. I don't know how many times people, I got to have vision coverage. I'm diabetic. That's your health insurance,
right?
Not your eye insurance. Vision. It's a little confusing. I mean, because we talk about accident insurance and we talk about vision insurance. Dental's pretty self-explanatory. Dental is dental, but accident insurance doesn't have to be a car accident. It's actually injury insurance. You could be burned. You could twist your ankle. You can fall off a ladder, or you could be in a car wreck. But it's not just a car accident. Usually when we say accident, you think car accident. And in vision insurance, it's eyewear insurance, really, is the easier way to explain it. It will cover your eye exam to get your prescription, because you have to have a prescription to get glasses or contacts, and then your plan will help you pay for those. It's not for eye care. If you have diseases of the eye, or with diabetics, they're double checking for macular degeneration. If you have cataracts, glaucoma, any of those things, that's health. That's not. Now, they'll check for those things generally on a routine eye exam.
Right, but they're not doing a thorough
They're not doing
check.
a thorough exam. They're not treating that. They might get you eye drops or something, but they're not treating, they're still going to send you to an ophthalmologist. The brand name Restasis is one of those that you hear the commercials cover the dry eye. Very expensive drug. And as I've said before in Medicare, if you see it advertised on TV, expect to encounter the donut hole.
Yeah.
Because it's just expensive. It's going to be a high copay, even if you've got one of the best, drug plans out there. And even whether you're on a marketplace plan or a group employer plan, those name brand drugs are going to be expensive, whatever way you go. And hopefully, because they do what they call preferred, because you can have preferred and non-preferred. And actually, this is the ironic thing. I mentioned the Restasis, and I don't like to use brand names a lot, but this one here, because it was a weird example, was there is a generic. I don't remember what plan it was, and I wouldn't have told you in this case anyway. The generic wasn't in the formulary, so it wouldn't have covered it at all, and it still wasn't cheap. So it was like it was going to cost more for this person if they did the generic than if they used the brand name. And there was no manufacturer's assistance or anything like that. So that was
generic, yeah. Well, and another thing too, touching on the vision insurance paying for, helping pay for glasses, contacts, things like that. Another thing that a lot of people don't realize that you get with these ACA plans and marketplace, and, I think that even if you go off the marketplace, that they have similar things, but Blue Cross has what's called Blue 365. Mm-hmm. So it's a ton of discounts that you get just for being a Blue Cross Blue Shield member. And I know Ambetter has one as well. I'm not sure what Ambetter's is called, but a lot of times that I've noticed, we don't have a vision plan because using our Blue 365 is more beneficial to us, and you don't have to pay for it.
There you go, because you're getting the discounts.
Right, because you get the discounts for being Blue Cross. So, in my case where my eye exams are covered by my health insurance, a lot of the Blue 365s will say, if you pay for your lenses, you get your frames free when you order them from a certain place. Or opposite way around. We'll pay for your lenses, you pay for your frames.
Right.
And so in cases where people may need more coverage, that's always something to use.
All right. Well, we're running out of time, and we have not run out of material, so stay tuned next week. We're going to continue this conversation, but it's going to be on another show. So until then, check us out at insurancematchmaking.com.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.